Parents World Let's Talk, and today we are going to talk about breast cancer. And here with us is Dr. Lim Kuan. Welcome to Parents World, and let's hear about yourself.
Hello everybody, thank you for the invitation to come and join me on your talk. I'm Dr. Lim Kuan. I'm from Solis Breast Care Center, and I manage breast conditions, both benign and malignant, day in, day out. So today we're going to talk more about breast cancer. Well, according to our local stats, we have got about 30% of all female cancers being diagnosed as breast cancers every year. So the incidence in our population is considered high. About 1 in 13 women will get breast cancer in their lifetime. So today, let's talk about it so that we can raise awareness.
Yeah. So I don't know, the number is so high, apparently in Singapore. So I think the question that we have here, is there any way to prevent, like breast cancer in the early stage, avoiding it?
Okay, so you can't really prevent breast cancer, but definitely there are a lot of things that we can do to decrease the risk of breast cancer. So for risk factors of breast cancers, we actually divide it into modifiable and non-modifiable factors. So non-modifiable factors are like age, being female and or having a family history of breast cancers that we can't change. But there are things that we can change. So we are talking about modifiable risk factors now, which include like our lifestyle and our diet.
So food is a play important role, right?
Yes.
On avoiding it, and lifestyle as well. So I think no stress.
Yes, stress is definitely what a lot of my patients complain about.
I see.
Yeah.
How about food? Is there any kind of food that we should avoid, totally in order not to have a risk of breast cancer?
Well, the thing is that it's difficult to make very strong dietary associations with breast cancer. But we would say that keep to a healthy diet, right? Take less red meat that has been associated with breast cancer, and also try to drink less alcohol. I think most importantly, there are a few factors that we need to raise, regarding lifestyle. Number one, because it's for the audience of Parents World, and we are probably having a lot of young mothers listening in. So I would like to say that number one, please breastfeed if you can, because
that's a very good advice for all the mommy there.
Yes, because breastfeeding actually decreases your risk of breast cancer and ovarian cancer long term. Yeah. Number two is maintaining a very healthy, exercise and healthy weight, basically. Yeah. Because obesity has been known to be associated with higher breast cancer risks.
I see.
Yeah.
So summarize is like fresh food, maybe more vegetables and fruits, not preserved food, and then exercise more. And then of course for moms who are going to have baby, is breastfeed is very important. Okay, that's good. So may I ask, who is the most vulnerable or high risk of developing breast cancer?
Well, the people who are at high risk would be people who have a family history of breast or ovarian cancer, and also people who actually have a personal history of having atypical cells in their breast, or what we call precancerous lesions. So these people may have like up to 5 times or 10 times risk of the general population. And I guess the highest risk will be people who have a known inherited genetic mutation. For example, in the case of Angelina Jolie, she has got the BRCA gene, right? So the BRCA gene can give up to about 70% risk of having breast cancer in their lifetime.
First time I heard about PRC.
BRCA.
Oh wow, that's interesting. So how can you find out if you have PRC? From the test you can?
Yes. So
lab test, normal lab test?
Yes. So we can do genetic screening, and this is just a blood test. But of course, we have to choose who we offer this genetic test to. We don't offer it to everybody. Usually, we have criteria. If you have multiple family members having breast or ovarian cancer, or have any other strong risk factors like a young patient with breast cancer, then we will offer the genetic test.
I see. Okay. And do you think how often one should go for health screening? And if it is not on a high risk, how long they should go for screenings?
Oh, okay, so women like you and me at average risk should be going for breast screening according to the national guidelines, which means age 40 and above, you start your breast screening. Every year between age 40 to age 50, and after age 50, every 2 yearly if you still are well and without any symptoms.
I see. Okay. And mammogram or breast ultrasounds? So, yeah, which one to recommend for women who are going for routine screening and at what age?
Yeah. Okay. So mammogram is still the gold standard for breast screening worldwide, right? So if we can only choose one, we would choose to do the mammogram because it allows us to pick up very, very early cancers, and we start mammogram screening about age 40. Yeah, but you find that a lot of times we do order an extra ultrasound on top of that. It's because the ultrasound is a different camera. It allows us to assess the breast better if we have it as an adjuvant kind of adjunct kind of modality.
I see. And if a lump detected in the mammograms, what does it mean and what is the next step? Does it mean it's always cancerous when we detected a lump?
Yeah, so don't panic first. So when women go for breast screening, there are many times that they are recalled for evaluation. Sometimes due to like what you say, a patch, yeah, or a possible lump in that is noted on the mammogram. But firstly, we have to assess it, like I said, with another modality like the ultrasound. So that will confirm whether there is a real lump or is it just due to uneven tissue. And if there is a real lesion, the ultrasound allows us to assess the shape, the size, and the nature of this lesion, and then we will tell you whether it's suspicious enough for us to recommend a biopsy.
So what is a breast biopsy and when does it become necessary to do it?
Okay, so I'll answer when it's necessary first. Okay, so usually when there is a suspicious finding on your mammogram or ultrasound, your doctor will want to have some cells for test under the microscope, and that is when we will advise you to go for a biopsy. A biopsy is a simple procedure, usually done under local anesthesia only. All right, and we aim to take a sample from the lump for test. Okay. So it's, the cut is very, very small. It's a 10 minutes procedure for us to put in our needle and extract a few cells, a few cores of tissue for test under the microscope. Okay,
so what advice do you give to women who suspect there is something amiss when they do a self-examination?
I would say get a consult with a breast surgeon if you feel anything wrong in your breast.
Okay. Yes. Can breast cancer actually completely cure?
Of course.
Okay.
So breast cancers are usually quite curable. In fact, probably up to 80+% will be curable. Especially if it's found early, right? The survival rate is very high. For stage 0 and stage 1 patients, if you compare the survival rates with the general population, it's, the relative survival is 100%.
Wow,
But of course, of course, with increasing, higher stage, then the breast cancer survival drops.
So it's, may I know, like stage what that is necessarily too late, like a bit so-called, it's more difficult to be cured, like 4 and above?
That's right. So at stage 4, it means that the breast cancer cells have gone out, yes, of the breast and to other organs. So in such cases, we can't say that we can cure the patient, but of course we still have very effective treatment to give the patient a good quality of life for a long period of time.
I see. Can you give an idea about like treatment options available for women with malignant breast tumor?
treatment options. Well, the cornerstone of any breast cancer treatment is still surgery because whatever is malignant needs to be removed. Okay, and after removal of the cancer, we usually need some form of adjuvant treatment that is to decrease the risk of it coming back in the future. So the adjuvant treatment can include radiotherapy, hormonal therapy, and sometimes chemotherapy.
And can you give us a brief overview of what services that you offer at Solis?
Okay, so Solis is an integrated breast care center. All right, we can walk the lady from screening to diagnosis to procedure, the biopsy procedures, as well as the pathology report to treatment, cancer treatment. We have a very strong team of breast surgeons, subspecialized breast radiologists, and also pathologists to give that kind of care.
So does it mean like you're like one-stop solution for women who want to do, breast examinations in your clinic?
Yes, you can say that.
I see. Okay. So thank you so much for sharing about breast cancer awareness with our readers, online readers. And here I have a little token for you. It's our sister company who have a tea, yin yang tea. So we have a cooling tea for calming at night, sleeping, and then we have a detox tea as well for morning wake up. And we also have a balm, calming balm for you to use, cooling one and the warm one for remove pain, aches, and stress.
Thank you. I'm looking forward to using it.
Okay.
The stress relief.
Yeah. So hope to see you again. Thank you so much.
Thank you.
Thank you so much, our Parents World online readers, and here with us, Dr. Lim, and we hope to see you again in our next episodes of Let's Talk. See you.
See you.